Welcome, Dr. Jeanette Kern to Monterey On Tonight.
Welcome. Thank you for the
So
invitation.
nice to have you
here.
here.
This is wonderful to be on. I've seen your show a few times, and I've really enjoyed how you mix it up with the videos.
Well, we have a lot of
have
fun.
We
do.
Fun with
we
it.
have a lot of fun. In fact, this is our Saturday night date, Gary and Jules, and this is what we do
nice.
for our Saturday night date.
You get to have another guest all the time,
We-
so that
we
you learn
do.
about Monterey.
We learn about what's...
We figured out how many guests have we had so
Oh,
far?
gee whiz, over a couple of hundred, I think, since we started. We've got to meet a lot of people by doing this show, too.
Yes,
But we
yeah,
knew
no.
you before we ever started doing television.
here in Monterey.
Yeah. Shall we tell everyone how I met Dr. Kern?
Sure.
Well, when we first got her, this is, gee whiz, 5 years ago.
And I was looking for something for us to do.
Yes, and why don't you finish that story?
Okay.
This would be good.
Yeah.
Well, I was looking for something to do, and I had no idea at the time that there's always something to do
In
on the Monterey
Monterey.
Peninsula.
Absolutely.
And so I was looking, and I saw the Make-A-Wish event was coming up, and I'm trying to remember who the guest was.
I don't remember.
Was it
That was
Jay-
about 4 or
not
5 years
Jay
ago.
no, it was not Jay Leno. It was George Lopez.
George
George
Lopez.
Lopez,
George
okay,
Lopez was,
right.
Yep.
and we just got our new puppy. Remember
Right.
that same night? I remember we just got back from our honeymoon.
I
Right?
think it
Did we
was,
just got
yeah.
back from our
Yeah.
honeymoon and we
Yeah.
had a new puppy at home, and so we went to the Make-A-Wish and met Jamel,
Yeah.
and all of the gals that all co-chair the event are wonderful.
Valencia and
Yes.
Helen Madera. Oh yeah, great.
Go ahead.
group
And,
of
why don't you
ladies.
name them since you're?
Well, I don't know the fourth one. I think Valencia, Puccinini, Jamel, Helen Maderas, Kasenji, I think is her first name.
Yes.
That's
help
all
me
right.
with the other
Don't-
two.
don't-
Tina.
Dina Eastwood. Yeah,
Dina.
gee. Can't remember the
It's
fifth
okay. I've got the
Musketeers.
photo. I'll go pull it.
But
I'll pull it.
beautiful women, inside and out. Every single one of them are just. They care about those kids. They want to raise a lot of money for them, and
I saw
they
you
know how to help
supporting
us.
the pre-event activities.
I
You
did.
get quite
I
busy
did. I did.
with the setup.
I did. I enjoy causes that are for our children and women. That's kind of my.
So we
my
met
little
Jamel,
soapbox.
and I said, Jamel, Gary needs a dentist here, and she says, we've got the best, the best. You won't even know you're at the dentist.
That's
You
the
will
goal.
feel like you're
And
at a
that's true.
spa.
Yeah.
And sure enough,
Dr. Jeanette Kern.
Yep.
Anyway,
Very
let's
happy to
talk
hear
about
from
what's happening in your practice these days. Lots of exciting things.
We have some new things going on. We just recently had some consultants come out from both Florida and Illinois who helped our hygiene team. And we're learning new methods on what's new in treating periodontal disease, which is gum disease.
Yes.
And this is big right now. I don't, for the lay person, for most of our patients, they don't realize that we've been researching all of this about gum disease and the whole body health, but there's a huge, huge connection. I mean, we know that gum disease and heart disease and diabetes and all of these things are all connected. And so we are getting cutting edge information. We've got new antibiotics that we can use in the gum infection itself.
Wow.
We learned about some new instruments that are out there, the laser, how to use that. So we're real excited. We're ready to start getting people healthy.
How does someone know they have periodontal disease? How do they know that?
Well, gum disease is kind of a silent killer of teeth. Most people don't know. They may get some signs with bleeding gums, bad breath, the gums pulling away from the teeth. That's a sign of gum disease.
Is there preventive maintenance for that? Is there anything you can do to prevent that from happening?
Well, it's a big circle of what causes it. I mean, it's not just not taking care of your teeth at home, because that of course is basic. You know, everybody knows you have to brush twice a day and floss once a day. But getting your teeth cleaned regularly is very, very important. Maybe every 90 days to 120 days, we know that bacteria gets thick enough that the body starts responding. So periodontal disease is not just plaque, it's also how the host responds to it. And we are the host.
We are the host.
We are the ones who get stressed. We are the ones that don't eat right. We're the ones that don't sleep
can there be
right.
a genetic disposition and more, towards more of a plaque buildup
Yes,
problem.
absolutely.
So there may be some people that maybe should have teeth cleanings maybe every 3 months,
Yes,
maybe? Okay.
Yes. We're actually finding out that there are like 500 species of bacteria that live in our mouth.
Really?
Wow.
It's
I had no
huge.
idea.
It's
Oh
Did
my
you know?
goodness.
I
No,
did not
I didn't
know
know
that.
No, this is a bacterial infection, and so what we find is that some people have a gene that they're more susceptible to it. So they have like 28 million bacteria. So it's a bad deal. You know, it was never fair. You always had siblings that would come in, and one would say, you know, I brush my teeth all the time, and I have this gingivitis, and my brother doesn't brush his teeth, and nothing's happening to him. It isn't fair.
Yeah.
Life isn't fair,
Yeah.
and it is. It's that host resistance. You were right on. It's not just not taken care
So a 3-month dental cleaning by a professional dental hygienist is the best way.
I think it is a very
you
good
can't-
way we can help you keep that disease controlled. We can recognize it early in patients. We can see the younger people are getting it. We're starting to recognize gum disease earlier because our diagnostic methods are better.
And I know you have some great dental hygienists in your office
have-
because I go to one.
I have fabulous hygienists.
You
in
want to
my
mention
office.
who they are?
I had, well, I used to have Christy, who has retired now. She's become a mom, stay-at-home mom. We have Stacy Russo, who's been a hygienist for over 12 years. She's fabulous. We now have a new hygienist coming on board. We have both Jamie, who has been in the dental field for quite a while, and then Julia. So
Oh,
we're
great.
very
Oh,
excited. So
exciting.
we have a
Great.
very educated team. They're very excited about this new training that we had.
And you know what I love about your office, Doctor? It is one of the best smelling offices. You are burning some candles in there, and when you walk into Dr. Kern's office, it always has such a great smell.
You know what? Will you stick around so we can
Sure.
Yes,
come
let's-
back? I'd love to talk more
Sure.
about that
Absolutely.
experience
You
because I
got
know
it.
that we could have some viewers out there that maybe
Are
have
looking.
have a little anxiety, maybe
Yes.
haven't been in a
Right,
while, and
right.
and I think that's going to help them. So if you'll
Okay,
stick around,
sure.
There you go. And we're visiting with Dr. Jeanette Kern right here on Monterey On Tonight. And I have a question, Dr. Kern. Why is it that in the past people have been so afraid of going to the dentist?
You know, I think it goes back to our old image. You know, we used to be in the Wild West. This is what this reminds me of. You know, we weren't exactly customer service oriented. And the times have changed.
I'm glad to hear that.
Yes. Well, we were always associated with pain. People always waited until they had pain, and then they came to see us. So we have tried to change that in our field so that people come to us as a relationship for their health. We want to be there for you when you're healthy. We want to keep you healthy, teach you how to be healthy. And you were talking about our smells. We have a lot of aromatherapy candles. We have aromatherapy oils too. And everything is designed in my office to create a very calm spa-like environment.
As you sure do.
And that
can-
helps people get past that.
I can tell
fear,
you
too.
that. No, it's really a comfortable setting when you come in. And one of the things that I also found is that now when you administer, is it Novocaine?
Yes.
It doesn't hurt like it used to.
when I was
Why-
a little girl,
why
boy,
is that?
Thank
hurt.
you. Well, we use numbing gel to numb before we numb.
Oh.
And we also have something brand new in dentistry, which is really exciting. I think a lot of people are going to like this. It's called Auraverse. It's a product where we can actually reverse the numbness.
Really?
Really?
So instead of going to that board meeting, not being able to talk, by the time you leave our office and you get into your car and you get to your meeting, your numbness is
Oh,
gone.
that's wonderful.
So we're excited about that.
Oh,
People have
that's
asked for that
great.
for a long time.
So that's how you do it. You actually numb the gum before you actually give the injections.
Yes, and for our very fearful patients, we also have sedation dentistry.
Oh, you do?
Which is a nice little blue pill that you take and you get very sleepy and relaxed and comfortable. And our patients really love it.
Love that.
Yeah, we
That's
we
something
laugh.
for
We
you.
say, yes, you'd love that little blue pill. I tell people they can fly to New York in coach or they can fly in first class.
Oh, well,
it's their
listen,
choice. And
you
they
are
can-
definitely first class.
Well, thank you,
I'll
Gary.
vouch for that.
I always enjoy when you come in, and you never seem to. You don't need that blue pill, but you.
Well, she might. Yeah, she might.
I'm a little more round up than you.
Today now, and I know there are dentists that specialize in handling young children.
Yes.
Now, do you take young children as patients in your office?
We don't see very many children.
You don't.
We've kind of created a very spa-like environment.
Mm-hmm.
My adults, especially my ladies, love coming.
Mm-hmm.
We do paraffin hand treatments.
Oh, that's right.
We do nice warm neck pillows. So when they come in, we kind of create a space for them.
Uh-huh.
It's just, you're special there.
And there are
Special there.
dentists specifically for
For children. And you know, the kids like those kind of offices.
yeah.
They go, they play their little games, they
I
have
see.
videos that are designed for them. It's a great environment for them. And that's the other thing. Again, customer service. We want to make the experience good for you.
Yes.
We're there to serve you. And
Well, you sure do it. I'll tell you. I have to tell you all a quick story that when I was a patient some time ago, and I first went in to Dr. Kern's office, and everything was absolutely perfect except for one thing. And I said, I made a suggestion.
Oh, yes, you did.
And I said, Dr. Kern, you have everything just absolutely perfect, but there's one thing I want to suggest. And she said, what's that? And I said, your water bottles need to have your name on them.
The label.
And guess what? The label. And you did it within a week.
I did. And that was thanks to my
What
husband,
a
Kevin.
personalized, that was like over the top.
Well, thank you. That was an excellent suggestion, and I took it to heart.
You did. And so now when I go in, I take my personalized Dr. Kern bottle home with me.
And now I get to take my personalized cup, and I thank you so much for my gift.
And you
I love
have
this.
a Monterey On Tonight cup to take with you. Thank you so much
And
for
thank
being
you
here
for
tonight.
everything that you do for the Monterey Peninsula.
Thank
You do so much
Thank you,
for our
PWM.
community.
Thank you. PWN, I do.
Yes.
Professional
love that.
Women's
Network.
Network.
Love
Yep.
that. Yeah, I think it's a great place to live, and I want it to stay that way too. So let's all give.
Well, thank you
Okay.
so much for being our guest tonight.
You're welcome.
We really enjoyed
Thank
having
you.
you.
Thank you.